Yes, welcome back to the Magic Sponge podcast, the miracle cure for all your rugby league injury issues. I'm Brien. I'm the guy behind all the NRL Physio content you see on socials. My co-host, James, you are here. Mate, like, I'll put it this way. On a daily basis, I get made to look like an idiot. You know, like whether it be my wife, my kids, at work, I'm pretty used to it. But I have to say that I've never felt as good looking like an idiot than on Wednesday night when Daddy Billy he just got all that Queensland spirit and put on quite a performance. He made both you and I look like we didn't know what we're talking about, which we don't, and I'm glad about that, mate, because Queensland are Origin champions again. Good to have you, mate.
And you, Brian, I think, I'm just another idiot on the internet. No surprises there, is it, Brian? But, what we had, we have so many stories out of this, Brian, don't we? We had, Robbie Coolwell, Namble Crushers in the camp beforehand. We had a bit of Namble Crushers yarn in there. We had Queensland Spirit. We had Drama Deluxe. It felt like Daddy Billy coming home, putting me in bed and reading, The Very Hungry Caterpillar, putting me to sleep with a warm glass of milk. I was really, really happy with that. Clinical perfection. you know, the perfect performance. Billy Slater in a bronze statue outside of Suncorp. Tom Dearden in 2025 being the yarn forever and ever. Who needs Joey 05? We got Dearden in 2025, Brian. I just don't see how Queensland can ever get better than that. That's just going to be one of the folklore stories. It's 32 sets out of 32. It's the first error in the 68th minute. We just played the perfect game of footy. Heaps of New South Wales fallout, and most of it I think is just hot air. The Cleary stuff, the Yo stuff, the coaching stuff. I think the performance was too good. But the thing I really like about the dribbliness of the fallout is there's there's a there seems to be a little bit of sentiment this time around, Brian, of maybe we don't get it. What are we missing? There's something wrong. It's the self-doubt that's crept in now, which is really what Queenslanders really love and find super funny because, the Queensland spirit, we do yarn it up and we do G that up. But it's really quite funny now where it seems to have picked up a bit of steam in popular culture that people in New South Wales are like, why do we keep losing with the best team? Maybe we don't get it. What's wrong with us? Maybe Queenslanders just love it more. And that's just been going on and on and on this week. And I am just eating it up. Like I'm at the buffet and it's all you can eat Pizza Hut. It's phenomenal. I'm here for it. Brian, tell me you're about it as well with the dribbliness because the fallout's good. It's almost better than the win.
Mate, I've consumed I've consumed more content on footy in the last like 3 or 4. Like I've been staying up till like 1 o'clock in the morning just
100% the
watching
same.
YouTube
Yep.
YouTube podcast shows like us. Just give me more. Like, and they're saying the same thing over and over again, but I don't even care. I just want to hear it all. It's amazing. I think the thing for me, which kind of shocked me a little bit, was how much, and like obviously there was the Cam Munster's dad thing, which is a very isolated circumstance and stuff like that. But I was shocked at how much they all seemed to buy into the Josh Papali thing, where it was like, we're doing this for Papa, and like took him up on stage, like to lift the shield. Like I love Papa, and he is a Queensland legend. Don't get me wrong, but I was just shocked at how much that seemed. Like all the boys in the post match were like, yeah, like it was just so good to do it for Papa. You know what I mean? And I was like, oh man, they must have really dialed up that side of things to get the emotion behind it. I think, like along with the Cam Munster thing, obviously, but yeah, that was the thing I think. And look, I do want to say to it, I've had quite a few people message me this week being like, oh, you shouldn't have been so negative. Like, you got to have faith, all this kind of stuff. James, we're at the end of the day, we're just two Nuffy fans. Like, we're both physios and we talk about, the physio stuff. And I like to think we're a bit above Nuffies when it comes to the physio side of things and the injury side of things. But when it comes to footy, man, we're sitting on the couch drinking a couple of cold ones and just watching the footy. That's all so that when we have our little rants on here, that's all we are. We're not experts. We're not trying to claim that at all. And yeah, we ride the highs, we ride the lows, and we definitely like to go up and down with it. I don't just stay neutral. I like to, have my say but it made it all the better. I think the fact that I was so down after game 1 to rise back up after game 3, it's just made it, yeah, all the sweeter, mate. So we won't, we once again, we won't make the podcast full. I'm sure New South Welshmen particularly are sick of hearing this kind of stuff, but I know we needed to address it to start with. I will say, mate, I joined in with the Baller guys on Friday night to do a bit of a live watch along, which was really, really good. We watched the Finns and Sharks game. Unfortunately, the Finns lost, but I wasn't expecting much anything else than that because the Finns are getting to a really grim stage with their forward pack at the moment. But I will say I think they were quite kind to us in that they put out a video, sort of saying to all the doubters of young GI Gamut Shibasaki, they include Gordy and a few other things. And I actually said to him, I'm like, boys, you're being kind to me and James there because we did live react to Gemmet getting picked and we were quite shocked. So, shout out to those boys. We'll talk about the Run Home Challenge very shortly or with SuperCoach Corner. But yeah, it'll be good to get into the SuperCoach and finish off the season strong. So look, guys, we are on YouTube everywhere you get your podcasts, your one-stop shop for all things injury analysis in the NRL. We loop everything back to SuperCoach and fantasy, especially finals coming up. Could give you that edge to get over your opponent. Let's get into the injury wrap for this week, which is brought to you by PainPod, drug-free pain relief anyone can use.
I don't know exactly what he's done. I would have thought it was an ankle, but I'm just guessing.
He shouldn't be out for a long period of time. I mean, I'm no doctor. We have to wait for the scans, obviously, but that'd be more positive than negative.
Round 19 and post-Origin 3 wrap-up, Brian. So, HIAs out of this one were Mark Nicholls, Brendan Piakura and Semi Verrills there from the Titans. Any things you want to add for those three players in particular, Brian?
Oh, Mark Nicholls, mate. As I said, the old Finns middle forwards, they're not looking in a good way at this point in time. So he'll miss next week. Piakura has the bye next week, but he's got probably the most extensive concussion history. He's had some struggles with concussions in the past. So one to look out for there. Sammy Verrills was late in the game, but he looked pretty rocked. So I'd be surprised to see him next week. Although in saying that, James, and I think the biggest HIA news of the week, which it's not on the run sheet, but because it wasn't officially concussion, I'm not sure if you saw the Matt Burton one last night.
I saw it clipped up on Twitter, yeah.
Oh, mate. Like my answer to, like, and apparently Burton said post-match, like, it was just a burner. And people, I got, like, I put out the thing on Instagram today, questions, and I reckon 30% of them was how does Burton not fail or like what happens there? And like I come back to again, like I've just given up trying to put energy. I just think it's a waste of energy at this point, and as unfortunate as it is, because we're not going to get any clarification from anyone. There's not going to be anyone come out to tell us why. There absolutely could be a reason for it, that it's a neck burner down into the shoulder. But I think someone's sitting there kind of explaining that and explaining why his eyes glazed over and why he stumbled and what, tell me why a burner caused all those things as well. And not just me, the fans. Like I don't, once again, I think, for us, it's definitely not for the benefit of the medical professionals. It's the benefit of the fandom. And I'll come back to, this isn't like we're getting lots of fans and you could say, and even me, I'll include myself as a fan here. Absolutely. Like you talk about people who've never sat and assessed these in real life before, right? So we are people who don't know that process. But when I'm getting, and I counted after the Sam Verrills one, I had 5 medical professionals who do this stuff for a living message me. So that was 3 sports doctors, a neuroscientist, and a neurologist all message me. When you've got like that, and it's not like I've got like a bazillion medical people and I'm trying to sound like a big dog here. It's just like people lose their mind, and it's not just fans. It's like medical professionals who do this stuff as well. They're all like, how the hell? So yeah, unfortunately, I think it's just wasted energy at this point in time. That the response is that, the doctors who were there didn't think that any signs of concussion were shown, but we're never going to get told or we're never going to get explained why not that was the case. So yeah, unfortunately we're stuck here again, James. I feel like we feel this question probably once a month, with a pretty significant one. But yeah, like Burton didn't look good is all I can say. He didn't look good, and if that was for a burner, it must have been a pretty nasty burner, hey.
Yeah, most definitely, Brian. I think it's almost to the point where it is what it is, and don't try to overthink it and make more sense of it. Just you have to cop these decisions and move on as a fan, unfortunately. But it is frustrating. I hear that
We
perspective.
just have to
First
wait
game
for
around.
those. We just have to wait for those objective
Sorry, yeah.
tests, mate. Yeah,
Yeah, that's the
waiting
thing.
for
Yeah.
so for anybody, at the moment it's all subjective stuff. So a lot of balance stuff, asking them recall, all those kind of things. But it come back, and we've had plenty of players come out, post career, mind you, and say that they game the HIA system. So during baseline testing in preseason, they answer worse than they usually would. So they only remember, X number of words as opposed to, let's say there's 10 words. They remember 3 of them purposely so that they only have to remember 3 during the season and these kind of things that's simplifying the process, obviously. But yeah, while it's subjective, it leaves like gray area for these kind of things. But once we have these saliva tests, these blood tests that come in that can produce results within 15 minutes, which there's a few out there at the moment now. And there's one, I think, going in over in the States somewhere in a professional sporting league. So they're starting to roll out. So I think we'll hopefully be in the next 3 to 4 years be getting that over here as well, which would be good.
Yeah, fingers crossed about that one, Brian. So we'll talk first game of the round, Sharks v Dolphins. Trai Fuller was ruled out pre-game. Don't have much update about that injury status there for Trai Fuller, fullback from the Finns. Addin Fonua was reported as a leg concern, and Cam McInness is another one who's befallen infection, Brian. We need these boys to start having showers, don't we? There's a lot of infections kicking around, a lot of boils going around in the NRL this year.
Mate, I can't get over it. Like, I've got no explanation. Like, I think I got heaps of questions about it, like what's going on with the infection stuff. I've got no idea. I really don't know, but it is crazy. Like, I think it has to be just a statistical anomaly, like an outlier, I would assume. But obviously, yeah, it's just unprecedented, the number of infections that we've had, and it's not slowing down either. So he came out of hospital the day of. I think Britton Nickera had a baby the day of. Addin Fonua had like a close family member pass away. So, like, Cam McInness was like, I've got to play because if those boys are playing, then, like, I've got no excuse kind of thing. So, yeah, but these infections, man, they are running rampant. I don't know why. I haven't got much explanation for you, but, yeah, it seems to be happening. And Fonua, he did have a leg concern. It was his left thigh was wrapped up. Now, that is the opposite leg to he had a groin issue in his right leg earlier this season. So it's the opposite leg. It looked like the strapping, I didn't see a mechanism. I went back and tried to find it. It looked like it was strapping sort of on that lower thigh for like a cork kind of thing. It potentially could have been to try and provide compression for a minor strain, but more looked like a cork kind of strap. So hopefully that's all it is. But he looked like even with it strapped, he was moving around pretty well. So even if it is a strain, hopefully it's just minor. Trai Fuller, there was no reason given. He was just taken out an hour before. The one thing I will say, and I had one of the SE Playbook good guys, Max Bryden, kind of hit me up. I think it was even earlier that morning, sort of saying, what are you expecting from Trai Fuller? Should I start him in my draft comp? That kind of thing. I just wanted to illustrate a stereotypical textbook return from an ACL injury because Trai Fuller has been back for 4 games in Q Cup. So first 2 games he played limited minutes in, and then he's played 2 games at 80 minutes the last 2 weeks. So I went back and had a look at some stats, and stats don't tell the whole story, yes, but these support my bias, James, support my agenda, so I'm going to use the stats. So the last 4 seasons, he averaged about 165 meters per game in the last 4 seasons in Cup. The 2 80-minute games he played this year, he had 112 run meters. And then if you look at, they only had like fantasy points. They somehow have the fantasy points for for Q Cup, which I was surprised with. But he averaged 52 points per game in Q Cup the last 4 seasons, and then in the last 2 games in Q Cup, he averaged 26. So it's one of those things where, look, I'm not going to sit here and try and convince you or the listeners or all the physios and conditioning people out there listening about, return to performance coming back from an ACL, particularly for these outside backs. But when it comes to like SuperCoach and those kind of things, which a lot of people listen to this show for, it just shows you that, especially for those outside backs, there often is that kind of build up. Not everyone is like a Tino middle forward that can hit the ground running. And especially, I think there's a big difference between like a Tino coming off an off season as opposed to Trai Fuller coming into the season like halfway through. Because I think you've got, with the off season, everybody's kind of coming off the off season, so everyone's kind of the same conditioning. Whereas Trai Fuller's coming in, mate, and everybody's been playing for 20 weeks now. So it's you got a guy coming in fresh, like against battle hardened guys. It's just a little bit different. So just something to keep an eye on with Trai Fuller. Not really sure what's going on there, but for ACL injuries moving forward, it was just a good example, I think.
Yeah, it's probably one to watch. I guess there's going to be some Sam Walker enthusiasts, of which I'm one, because Sammy Walker's not long back off the ACLs. He obviously had a bit long with the thumb, but it might be a sort of a bit of a preclude to like what you'd expect out of his as a ceiling this year, and probably a good reminder for those who might be thinking about looking Metcalf next year. He's going to be probably one who's going to face a similar dilemma. Knights versus Stormers next, Brian. So pre-game, Brian Papenhuyzen ruled out with calf tightness, which probably sounds like a G up now, doesn't it, for missing 2 games with calf tightness. And then an update on Fletcher Sharpe. Sounds like his season is done and dusted, according to Barry Tui from up at Newcastle there. And then Dylan Lucas today, lisfranc injury. So that's season over for Dylan Lucas as well, Brian.
Yeah, mate, Dylan Lucas is a big blow, especially, he's very, very highly owned, I think, from a SuperCoach perspective. The lisfranc injury, a lot of people kind of were, postulating, because I kind of said it was a very simple innocuous mechanism, and people were saying, Jerome Hughes stepped on his foot. I went back and had a look at the tackle. Jerome Hughes kind of stepped back over, but barely put any weight on it at all, and that's not going to cause a lisfranc injury in the slightest. I just find, and we've spoken about it, that effectively you can get traumatic lisfranc injuries and fractures in the foot, you can also get those accumulation injuries. So it's almost like a stress reaction over time. So it builds up and builds up. You get some bone bruising, those kind of things. And then it's like the final straw and it goes. So whenever I see a foot injury that has an innocuous mechanism of injury and they end up in a boot really quickly, I'm like freaking out. And I was freaking out with Dylan Lucas. I didn't say it quite that strongly at the time on Saturday afternoon in the broadcast channel, because I don't want to freak people out unnecessarily. But from my perspective, I was definitely not optimistic. So season over for him. He needs surgery. Our good friends at Arthrex will be taking care of him, I'm sure, with a nice little tightrope to stabilize that lisfranc ligament joint complex. He should be fine for the start of preseason, because it'll be about a 12-week recovery period usually. So he'll be good. What are we now? This is the start of October, and I don't think preseason starts till November, so he should be sweet. So I've got minimal concerns for him next year. Fletcher Sharpe is the one. It's a medical case, spleen and kidney damage. His season is over. A few people ask, is he going to be okay for next season even? And the thing I'll say here is that when you're dealing with internal organs and those kind of things, like, all options are on the table. Like the odds are still overwhelmingly in his favor. We had, I think his name's Petraka in the AFL. He had like a pretty severe splenic injury. I think it was like in the last couple of years, and he came back. It was about 7-8 months later. So hopefully the same for Fletcher Sharpe. But obviously once you're dealing with organs, there's some uncertainty there. Mate, speaking of uncertainty, we're in Tommy Turbo areas with Paps now, aren't we? Look, we've spoken about how calves can linger, which they absolutely can. It can kind of, extend on. But for calf tightness to linger, like when tightness came out, I had a lot of people message me like, tightness is the biggest G up, right? And I think they're right because, yeah, it's a G up at this point. My thing with him, and we'll talk about my trade plans on who I'm going to go to later on, but I just think the hardest thing, and we speak about it a lot on here, we can't speak with certainty for a lot of things because we don't have all the information. We never pretend to have all the information in terms of, the treatment. We're not treating the player, all that kind of thing. But I think what we often talk about is what we hate the most when it comes to any of these things is uncertainty. Because if if there's information that comes out, it's a grade 2 hamstring strain, it's in the tendon, whatever, that's all information we can use, you and I, with our experience and, the data that we've got from past injuries and stuff, we can give, pretty good advice, I would like to hope, most of the time on those kind of things. But when we're dealing with something like this, which is calf tightness, but isn't behaving like calf tightness at all, like Paps could be back next week. He could be out for another 3 weeks and not get the goal kicking back. Like, there's just way too much uncertainty there for me at this point. So when uncertainty comes in, especially when there's other players at his position with huge upside, I would just much rather that at this point in time. Where are you at with Paps, mate?
Feeling the same, Brian. It's a tough one when we're as low on trades as myself and yourself are when trying to make a launch for the run home challenge from round 20 onwards. But I'm starting to get that little bit of a feeling as well of we're probably in risky territory here. We're risking re-injury. I think the Storm, they're sitting pretty on the ladder as well. Like they're pretty comfortably, well, they're not comfortably in second, but the Bulldogs are on the same amount of points. So they're probably pretty well on the way to a top 4 finish, and despite him resting the last 2 weeks, they won both those games, so they do have options there for coverage. So I think from a fantasy point of view and a Supercoach perspective, I'm getting a bit vibey. I'm vibing up some other options there, I think, Brian. We'll probably talk about that more in Supercoach Corner as we move forward. The other one about Dylan Lucas, sorry, mate, is for next year, he's probably a must start, isn't he, for Supercoach next year? He was that good at the position. If he's dual position, would he be one of those guys you have in your crosshairs as a must start for next year?
Yeah, 100%. I think one thing I forgot to mention with Dylan Lucas, and speaking about my bias and my, anything that confirms my priors, mate, but I had a bunch of messages. Yeah, I think it was about 30 minutes to go just before he did his foot that he reeled out of a tackle, clutching in his shoulder, that same shoulder. He landed like arm outstretched or something. So, the ticking time bomb was well and truly still there. But even with that ticking time bomb, I think by next year he should be fine. So he will be in my side come round 1 next year, I think.
Yeah, hopefully he keeps that dual position, makes him extra tasty. Dragons versus Roosters was the next game on the slate here, Brian. So Hamish Stewart was reported as a knee injury. Luciano Leilua was reported as a leg laceration. Sounded quite significant when you put it in the broadcast channel. It was probably a little bit unders for the amount of carry on that I saw on social media, to be fair, but maybe it was quite deep. So who knows? Maybe it was like deep into the muzzle belly there. Lastly on the list is Hugo Savala from the Roosters, reported as a wrist or hand concern. It sounds like it's a 1 or 2 week prospect, Brian, I think.
Yeah, so the mechanism didn't show much, but yeah, it looks like it's going to be 1 to 2 weeks for Hugo Savala. So any Sandon Smith owners might get a week or 2 out of them, which is good. Hamish Stewart with the knee, there was no clear mechanism, but it looked like he got strapped for an MCL kind of issue. So potentially like a minor strain there, a sprain there of some sort. Layla was a funny one, man. And I don't get people message me from the inner sanctum very often, but I had 3 people in the sheds at the Dragons messaging me about this. They're like, oh man, the doctor's like pulling bits of flesh out with tweezers. Like it's really deep, blah, blah, blah. And I was like, and especially because I got it from like 3 people, I was like, oh, this must be mega. And then they're like, oh, I'll send you the photo. And I was like, so that's when I sent the broadcast channel. I'm like, oh, this is going to be good. I'm getting fed all this info. Like it must be. And they sent it through. Look, like by all accounts, I think the way the photo was taken, it was like from down, and I think the laceration was from like up to down. So I think if you took the photo from the top coming down, apparently it was almost down to the tibia. So it was kind of through like tib ants, like in a downward angle, but it just didn't look as good as when the image came through. So I was a bit let down myself, but I think we're sickos for enjoying that kind of stuff. But yeah, it's very, very amusing.
Yeah, it's as I say, Brian, it's all about getting the right angles when you're trying to take a photo of something, isn't it? You got to get the right angles to make things look bigger and better than they usually are. Put a bit of mayo on things. Cowboys vs Bulldogs was the next one, Brian. So Jake Clifford was ruled out pre-game with a quad injury. That was a bit of a surprise, given that I thought he'd be named, and there was some shithousery around the sixth position again for the Cowboys. So that probably explains why he was missing. John Bateman's reported as a groin concern. Marcelo Montoya from the Bulldogs with a neck concern, and then Magic Sponge regular Jordan McLean here with a calf concern, or maybe an ankle concern, or another soft tissue injury. Firstly, Jordan McLean. Let's start there, Brian, because it's probably much of the same here. We can control key C, control V for the last 19 weeks, I'd say, for Jordan McLean. He seems to be here every week, doesn't he?
Mate, shout out Jordan McLean. He announced during the week, I think, that it's looking like retirement at the end of the season. So I think we spoke about McLean medal at the end of the season.
Yeah.
I think that'll be the Golden Sponge Awards regular for the most soft tissue injuries. I reckon Cody Walker's probably got it sewn up this year. It something tells me, but Jordan McLean might win it himself this year. I'll have to go back and tally it up and see who's been on the sponge the most with soft tissue injuries. But like probably a week or two. Marcelo Montoya has been playing through a neck injury, so he had to clean up about 6 weeks. They haven't stipulated. I assume it's some sort of disc injury or something like that, but they haven't really been too specific there. John Bateman, minor groin issue, miss a week or two, I think they said, or 2 to 3 weeks. And Jake Clifford, it's not often we talk about, I guess giving the coaches we don't like credit. But I absolutely flamed. The news for this came through when I was on the watch along, and I was like, because it just said Jake Clifford dropped. It didn't say quad, and I'm like, Todd Payton, and I lost it.
Yeah.
I lost it. I was like, how has he dropped Clifford again? Like, what the hell? And then it came out that it was quad. So I had to roll back my criticism and be like, okay, fair enough. But one thing I forgot to mention at the start of the show, which is relevant for the Cowboys chat, mate, even though we got absolutely daddied by Billy Slater and made to look like fools in regards to his team selections, which is great, one thing that definitely was well in our bias wheelhouse, and I've had a few of these tonight, is Tony Siebes letting Tommy Dearden go to keep Brodie Croft back at the Bronx.
Don't remind me. That's
I had to throw it in there
after game 3. I was like, this guy just won the Wally and we let him go for Brodie Croft. Oh, mate, don't bring it back up. Seriously. And we let him go when he was 19 as well, Brian. And he was the only one having a go in a Broncos team that won the only spoon we've won in our existence. Like, mate, those Tony Siebes days were the darkest of dark days, and we let go one of the genuine, now throbbers of the NRL, Queensland spirit, best performance ever in a series where it was must win in game 2, game 3. Honestly, just don't remind me. It's heartbreaking. It really, really, really is. Anyway, sorry. I'll gather myself together. Brian's just absolutely rattled me here. We'll move on to the Warriors v Tigers. So next game, Warriors v Tigers. Rocco Berry, shoulder injury here. Don't know the detail about that one. Sorry, Brian, so I can't comment there. Erin Clark is reported as cramping again. We sort of seem to mention Erin Clark from time to time, pumping out the big minutes. Maybe he's got those big old calf muscles getting into cramp territory pretty frequently. Samuela Fainu is the next name on the list with a knee concern. And then lastly, Starford To'a with a wrist or arm concern. This is off the back of the elbow injury not that long ago as well, Brian. Was the elbow injury last week as well or the week before?
Yeah, mate, I think, I've got a suspicion it might be all one and the same kind of thing. Like, he just seems to be like he was once again clutching at that arm again this game. No mechanism that I could see.
Hyperextension of his elbow, I think, was the last one. I think last week or maybe the week before.
So I'm not sure what's going on there. He's obviously playing through something, but we haven't really got much detail. There seems to be a lot of leaks out of the Tigers with other things, but nothing for injuries, unfortunately. Samuela Fainu with the knee. It was a pretty low velocity, like medial stress. So not much force in it, but his knee did collapse in a little bit. But it was that same knee where he's dealing with patella instability. And we've spoken about in the past that the risk for re-injury there is just significant. So, but the thing is, you can aggravate it, and he could be fine to play next week. Like he's had that happen a few times. The risk is that it, like if it's only a subluxation where it just shifts a little bit, it's a quick recovery, but that re-injury risk just remains and can even creep up and up and up and those kind of things. So at some point they might just need to shut him down for the year to kind of sort that instability out. Erin Clark, look, I only put it in there because I get so many questions about him because I think he's big in SuperCoach and people see him limping off. It looked like cramp again. And then Rocco Berry, shoulder dislocation, and shoulder dislocation. So it could be 3 to 6 weeks if he can rehab it successfully and come back, or it's immediate reconstruction and out for the year. So, we'll wait to hear what comes back about that.
Yeah, wait and see. It's been a bit of a disrupted journey for Rocco Berry of late, hasn't it, Brian? It's been one injury after the other. Next game was the Eels versus the Penrith Panthers. So Brien To'o, we've talked about him nursing the grade 2 LCL injury in his knee, so he didn't play this game. Liam Martin was a wrist injury out of the Origin game. I'm not too sure if they confirmed that was a fracture or if that was something else going on there from a wrist point of view. Then out of this game, Kitione Kautoga, he was sort of like an ankle eversion thing, suspicious for a syndesmosis injury, Brian, this one, isn't it?
Mate, it really frustrates me, this kind of stuff, because if anybody tries to tell you that they're still that like hip drop tackles are happening less, and it's not that we're the crackdown's gone, it's just that we're it's happening less. Like this was like the worst hip drops are where like players are stationary and you have like a third man come in, like we saw different ones over the years, like maybe the Jackson Hastings one and stuff like that. There's some pretty bad ones over the time, but this is the second worst. I hate this where a player wins contact, which Kautoga did. He busted through the line. He was carrying Tungo through the line and winning that contact. And Tungo's just gone right. And whether it's conscious or not or whatever, but he's just gone boom, lost the feet, dropped the hips, and just cooked his lower legs, which I just hate that. So, syndesmosis injury is the initial diagnosis. He'll be lucky to escape with a minor one, considering, I guess the high amount of force there. So, which is tough, and especially for I've got him in draft in quite a few leagues, and he was absolutely killing it for me. So, I'm expecting multiple weeks at this point in time. Hopefully, he can avoid surgery. We'll wait and see. Liam Martin with the wrist was a ligament tear, but not a. I think it was the radio lunate maybe off the top of my head. So not like a scapho lunate that needs immediate surgery. So he should only miss a week or two. Brien To'o with the knee, mate. I think his performance again was immense in Origin. Ran for like 270 meters. But I will say that after he scored that last try, he was visibly limping. So I want to throw to you as our SuperCoach expert. Where I am at with it is I think with how many throbbers I've got in my CTW, I want to see To'o healthy in a game before I consider bringing him in. I know you're a bit more bullish, so convince me why I should jump on To'o as soon as he's named effectively.
Well, I would say, Brian, you've had really good success with Panthers outside backs in the past, for one.
And he lit it up today, Paul.
Yeah, I know.
He's so good today. God damn it.
He always does. This is the thing, Brian. You're just one away from hitting the jackpot with Panthers outside backs. Just keep digging for the diamonds. I think that's what you need to do. I just really think he's just got an apex ceiling. If he scores, a couple of tries, which we know he's very capable of doing, he gives you almost an unmatched at that position. Because when we look at the draw upcoming, like round 20, they've got the short turnaround granted the Penrith Panthers. So they play today and then they play on the Friday coming. Play the Bunnies, West Tigers, Titans, Knights, Storm, Raiders, Bulldogs, Dragons. I almost think if you want to bring him in, you probably want to bring him in for the Rabbitohs, Tigers, Titans, Knights. So the next 4 weeks is probably a better play. Then I could hear an argument, depending on how good you're going with trades, that you could sort of look to move in probably not against the Storm actually, because the Storm can leak a few, but maybe against the Raiders and the Bulldogs in round 25 and 26. I could hear that argument. But if you're looking at run home stuff, I am happy to take the gamble on him being named round 20, 21, 22, 23. I think that gives you 4 really playable weeks that you could get some absolutely huge points out of Brien To'o there as well. Just have a look in terms of the games that they play, especially like there's 2 Friday games in there as well. So you probably have a little VC option there for Brien To'o if you want to get really vibey and really weird. So I would say if you're going to get in early, even if you haven't seen a healthy game out of him, would be my argument there, to be honest. What about yourself? What do you think? Just one game?
Yeah, like I've just got 3 trades left, mate. So
Yeah.
I don't think-
Use one on To'o.
If
Yeah.
I had 10, or even if I had 6, I'd do it in a heartbeat. So I think that's an important thing for people to consider. Is I think if you're a normal human being who has self-control and held on some trades, go for it. Like that run is hot. But yeah, for me, with 3 trades left, and I'm planning to use one on a potentially healthy Ryan Papenhuyzen this week, I don't think I can afford to do another one. So yeah, I wouldn't begrudge anyone. I just want to see him for a week before I consider using one of those precious 3 on him.
Yes, those vital 3. Titans versus Broncos was the last game of the round for the NRL, Brian. So we probably want to give a bit of an update on Ben Hunt. Things, pretty interesting update I think you've got about Ben Hunt and his hamstring concern, obviously from quite a few weeks ago. We talked about Payne Haas extensively on the podcast over the last few weeks. We'll probably just give an update on his back concern that he obviously rested this week. They've got the bye next week, so we should hopefully see him back for round 21. Then an update about Blake Moser, who sounds like he broke his jaw. I don't know if it's a training thing or a Q Cup related thing, but he will probably be racing the clock to be back by this season, I'd say, Brian, just given how jaw fractures usually go.
Yeah, Q Cup last weekend, so 6 to 8 weeks for him. So thankfully the Bronx have got the great Billy Walters to step in there. Mate, shame on anybody who fell for the Billy Walters dummy this afternoon when he scored a try. Like, what's doing? But Billy Walters probably heading for a Kangaroos debut at the end of the season if Kevy gets the job, mate. So,
That's very true. Get him in green and gold.
Number 14, the number 14
That's
special.
it.
Payne Haas with the back. Yeah, look, I think we spoke about that. Nothing much has changed since last week. Just to remind, the reminder is that he's got the bye next week. So a couple of weeks, they've given him the week off this week, bye next week. Like, I loved as an owner that he had this week off. Like, it's one of those things where I'm like, thank God he had the week off. It just raises my confidence in him into the back end of the season. So he's still not going to be a C or a VC option for me, but it just gives him a chance for it to settle down. People keep asking, has there been a specific diagnosis? There hasn't at this point. We spoke about last week how, that cortisone injection, it could have been a nerve root thing. It could have been a cord thing, like a disc thing. We're not really sure at this point in time. Hopefully we get it at some point, but not 100%. The interesting one about Ben Hunt, and this is a bit of a nerdy chat, is that he had something that I've never seen done on a hamstring before, which is called a percutaneous release, which is nerd chat for effectively he had a partially torn or really scar tissue, like just not a good, healthy hamstring tendon. And what they do with percutaneous releases, and where I've seen it a lot, is for trigger finger. So that's where your finger gets trapped like you're holding a trigger. And what they do is they take a needle and they go in and they effectively just jab the shit out of the needle, out of the tendon, just to try and break up the tissue around the tendon. And sometimes they almost want to release that tendon. So you're effectively tearing or partially tearing the tendon to kind of relieve some pressure on that tendon and kind of let it loosen off. It's almost like a manual release. We hear about it commonly, a manual release for like adductors for groins. They'll go in and release the groins in like severe osteitis pubis, like these kind of things to relieve pressure. So they're actually creating like a grade 3 injury on something. And Hunty had that done on his hamstring, which I've never come across before. I messaged a few a few sports docs about it as well, and even they were like, "Oh, I think I've heard of one, maybe." So, so he had that a few weeks ago, but by all accounts, it worked really well for him. I think the biggest thing is probably the re-injury risk with that is the biggest thing. It's almost like he, because I think he described it, it's the same one that they use for the ACL, which is the semitendinosus, and we know how guys post ACLs go with those hammies. They can be a high risk of injury, so it's probably the only thing. Maybe they've just told him to, hold back from the sprinting and just get it off the deck to Reynolds and Mam. But no concerns for you with like your likes of Payne Haas and Ben Hunt moving forward, mate?
No, I don't think so. I guess Hunt is a re-injury risk, I suppose, and Payne obviously is an in-game exacerbation risk, but I think you're happy to see him have the week this week and the bye next week. And from a Supercoach point of view, yeah, I agree with you not having a C or VC on him every week. But, if with him in your 17, you're very, very happy week in, week out of him as a playable guy. Lastly, Brian, we're going to wrap the NRLW. So Tamika Upton from the Bronx reported a cork injury here. Bree Clark secondarily with an ankle concern. Jamie Chapman with a hamstring injury or hamstring concern. And then Moana Courtney was a groin injury there. Brian, do you want to update a few of the NRLW stars there for us?
Mate, I don't think so. Like there was very few injuries from what I
Yeah.
could see or find in the W this week. Like I watched 2 or 3 games and didn't see anything too crazy. They all sound pretty precautionary. Like I think to the Bronx there was a few, but they were up by so much. Chapman got ruled out with hamstring tightness. There's our tightness one, and then Moana Courtney, we're just gonna have to wait for scans on that one. So yeah, mate. No, I think one of the best rounds for injury when it comes to the W for a long, long time.
Yeah, long may it last there, Brian. That's a good wrap of things from an injury point of view. Let's launch into the questions. So thank you again for everyone getting these through the broadcast channel to Brian. Let's go straight in. So question number 1, Brian, there's a video floating around on Brian To'o where he talks about his diet and he sort of reveals that it's actually not the greatest. And I think he talks about Coke Zeros and brekkie burgers and heaps of chips and aioli. Sounds like a great diet to me. That's like right in my wheelhouse. But do you think nutrition could be a factor as to why he's missing more games this year for what seems like recurring injuries? It doesn't seem to affect his output in Origin, Brian, because he had one of the all-time series for a winger. I dare say he was harnessing Origin Dane there as a Queenslander. It was one of the best performances I've ever seen. I don't look like there's too much impact there, do you?
Yeah, no. Like I think the LCL injury is a contact injury, so that and he had a few hamstring concerns earlier this season. But find me any outside back who's been through their entire career and not had some sort of like dealing with soft tissue stuff. Like To'o's been really, really good with injury. Most of his injuries have been like contact stuff. He's had very little like soft tissue things to deal with. So look, like with the diet kind of thing, I think with high level athletes like that, especially on game day, he's putting all that in, but he's going and burning it straight away. Like I know it's still not the best diet ever, but it's just it's not like if you or I do it, it then sits around our gut and we metabolize it and don't burn it off. Or sorry, we don't burn it off. Like To'o's using all that as just pure fuel. It's not the best fuel ever, but it works for him. So it's not something that I'd try and replicate myself when I take the dog for a run around the cricket ovals around here. I don't think I'd be able to do what he does before my game day. But yeah, I don't think it's a factor in his injuries so far because he is just an ultra athlete.
Yeah, and I think if it's just a game day thing, that's even less of a concern. I think if the rest of the week looks all right, if he has that as his game day routine, it makes him feel good. You know what they say, look good, play good, feel good. It's all wrapped up in that as well. So I think if that's a routine he's going with, I wouldn't be changing because geez, he is a weapon. Second question, Brian, is it looks like New South Wales are carrying injuries into Origin 3. There seem to be quite a few. Do you think that they would have been better served going with fully fit options instead? I guess we've got a few names on the list that we sort of talked to in the lead up to Game 3, didn't we? But what do you think about that?
Yeah, look, the guys that we're going to talk about here are just out and out guns. Like I think To'o is a great example to start with, right? Like he was limping pretty heavily by the end of that third game, but we had a look, like he went 220, 240, and then 270 meters in terms of like run meters. So 270 was the third game. Like, he was just an absolute jet. Payne Haas, like, he went from, I think, 150 to 140 to 120. So you could argue that as the series went on, he did lose a bit of output. But I think you and I spoke about off air. Like, if you sat me down before game 3 and I was Laurie Daly and you said to me, mate, like, you're going to get 120 meters out of Payne Haas tonight and 60 minutes, which is what he played. Do you think I would take him any day over like so many other options, even a fully fit? And I'm a big Taylor May fan, big Keon Koloamatangi fan. Like, I loved it that New South Wales didn't pick them, but like, give me the Payne Haas output any day of the week, even not at 100%. Same thing with Nathan Cleary, mate. Like, I know there's been a lot of we unfortunately, we are big Nathan Cleary fans on this show because he usually is like shitting all over our teams that we support. But like, even him, like, give me Nathan Cleary at 85% over so many other guys, just because he is so elite. I think where the discussion comes in is guys like Hudson Young and Stefano. Like, I think those are the guys where I'm like, look, Stefano had that calf niggle. I know Laurie did the pick and stick thing of like trying to build the culture and all that kind of stuff. And yes, Queensland tries to, bang on about that as well. But they're the guys where I'm like, well, if Stefano's at 90% with his calf issue, could we bring in a Keon? And I think there's definitely an argument there. And maybe it was just the pure number. You could argue there was probably too many. But I think at this point in the year, you would be shocked at how many guys are dealing with injuries that we just don't find out about. So, like, it's a very, very busy job as the Maroons or Blues physio and performance staff, because guys at this point in time, like we heard about Mitch Moses, right? Like he was on a strict training protocol that apparently New South Wales didn't follow to a T. Like, there's guys with strict protocols all the way through. Like, even Josh Papali'i, Ricky Stewart said that he had to have a chat to Billy and like run him through specifically. This is what Papa does for training now, because we're managing him because of a few different things and his age and those kind of things. So I think, yeah, like I know on the outside looking in, you can potentially blame that. And as I said, for maybe those fringe guys, I could hear the argument and for the overall number, but I just think there's so many guys dealing with niggles at this point in time. It's probably not as big a story as some would think. What about you, mate?
Yeah, I totally agree with you, Brian. I think the only one that really jumped in my head is, as you said there, about Mitch Moses. But, that was, maybe it was well managed, maybe it wasn't in lead up to game 2. But regardless, like, that was on the training paddock pretty early days. So I don't think that was really something that sort of got in the way there from that point of view. So, no, I agree with your takes. I don't think you're leaving any of those guys out, even if they're a little bit shy of 100%. Question number 3, Brian, is about Will Warbrick. So how do you think he'll go on his return? There was a bit of positive news there this week for him.
Yeah, it sounds like he's the Storm are hopeful a few weeks away. So in terms of on return, like, it's just going to be a gradual. Like, he's had a long time out of footy, so I'm just expecting a gradual sort of return through Q Cup, get his confidence back, those kind of things. So yeah, with concussions, it's just uncertain. He's got an increased risk of concussion moving forward because he's had this complex recovery process with this one. So yeah, just wish him all the best. But yeah, I don't think even when he does return, it's probably a couple of weeks before he's back in first grade too.
Yeah, it might be. Yeah, this is probably really deep, but you just keep an eye on from draft point of view. If he's sort of around for the Storm on the wing, you go worse than a Storm winger. I guess if you get desperate at centre wing as injuries start to potentially stack up, that'd be the only thing to keep an eye on. Next question, Brian's about Toby Couchman. Doesn't look like he's booked in for immediate surgery on his recurring shoulder dislocations or subluxations. Do you think he'll realistically come back this year? Seems like a long shot to me. Might be one of those things they just wait and see till they're out of contention. Brian, what do you think?
It's literally what I was going to say. Like,
Yeah.
I just think if they lose like the next 2 games, what's the point? Like, I look, I don't have the ladder up in front of me, to be fair, but yeah, I think it's more. I just don't see the upside after 3 shoulder instability events for the year. If they're out of contention, yeah, I think he'll get shut down. Is kind of my gut feel.
They are 2 points behind the mighty Finns, but, the Finns gonna win the comp, so it's a bit of a different prospect for them versus the Dolphins at the moment, isn't it, Brian, wouldn't you say?
Yeah, like I think the comp's so close, so maybe that's me
Yeah.
being a bit mean on them. Yeah, but I would say as soon as you said, like if they drop 2 or 3 more, and they're kind of out of it, I just don't see. I reckon there'll be immediate surgery.
Yep, fair
So
call.
so yeah, so I like in terms of I think people will be asking this. Like I get a few questions about draft. I'm still holding him in one draft league where I own him just in case, because I'm in a pretty good spot in that league. I think but like if you need like someone else, I wouldn't be worried about dropping him. He's upside. He's like he's okay, but he's still like a low attack forward. Like he's just base stats, so his upside isn't huge. Yeah, I'd just shoot for the stars with someone with upside.
Yeah, that would be exactly the same, mate. I'll be looking elsewhere with a bit of upside there. Next question is about Tom Flegler and his nerve transfer surgery. This question asker says, I've had that type of surgery and you can't imagine how Tom Flegler could ever get back to footy. Do you think it's possible? And have you seen any successful cases in your physio work or know of any other cases that have returned back to top level footy or contact sport?
Yeah. So I've only seen one and it wasn't an athlete. So it was a successful return to work. I think he was a diesel fitter from memory. But like he returned to full functional. His strength tests were really good in the gym and those kind of things. But like I wasn't trying to return him to, that high elite level. The thing I'll say here, and I think we've spoken about it in the past with any kind of significant nerve injuries, is they're just so varied. Like you've got everything from a Simon Dwyer who also had nerve transfer surgery to, people who've had nerve transfer surgery and are 110% and doing really, really well. So yeah, if this person particularly has had, an experience that they're like, I can't see how I could play footy. Well, yeah, like every case is different. So I am, and maybe this is the cynic in me as a Finns fan, but I'm starting to get a bit nervous. Like the Finns signed Morgan Knowles, which really puts a lot of like we've got a lot of middle forwards there now as well, and we just haven't heard many updates about him recently. So maybe that's just my gut. I'm not basing that on any medical information. I'm just nervous at this point in time that potentially he might not come back next year. But yeah, it's still just a wait and see. But it could be anything.
Yeah, very good point. Mate, to be fair, I've never seen any in my clinical role or clinical network. So, yeah, not too sure about the prognosis with that with Tommy Flegler. Like, I have a faint suspicion, Brian, just on people that we have seen with them, is Moses Leota had something similar to this in the past or something in this wheelhouse? I can't quite remember, but his name's just in the back of my brain for some reason. Am I off the mark
Yeah.
here? Am I
Yeah,
am I
no.
miles away?
So, but he didn't have the surgery, but he plays with the injury that Flegler had, but his just
I
wasn't as bad.
see. Wasn't
So
as
this
severe.
is the thing.
Gotcha.
Once again, like, Moses Leota, the same diagnosis, just his nerve kicked in more than
Yep.
Flegler's did.
Flegler's did.
So yeah, so he's able to play, but he plays with his shoulder. If you have a look, it's like heavily strapped and padded as well, to try and protect it. So
Yeah, good shout. Next question is about for draft competitions. Are there any injured players that you think might have been dropped that you consider stashing for the finals time, Brian?
yeah, I think just high upside guys. Like I like the wingers, like Tui Piloto and Xavier Coates is someone who might be floating around on your waivers after some buy rounds and those kind of things. Yeah, they're Tui Piloto is probably my one because like I think especially for draft, like we talk about Tui Piloto being like never again. No, like usually it's mostly classic because you got to spend a trade to bring him in, then a trade to bring him out in draft. Like you're just wasting like a waiver spot or something like that, and the upside is there. So like, give me upside guys who are injured in draft at this point of the season. Yeah, Keanu Keeney I think is the other big one, but he's probably been picked up at this point by now. Have you got any others that you could point us in the right direction?
Yeah, the only other ones I thought, like, Kale Ero's going to be racing clock before the end of season. So there might be a case for him if you think that maybe he gets back before round 26, round 27. maybe. But the only other ones would be maybe a CY Wong. He's sort of around 22, 23 from the MCL. And then Jareem Buller is around 21, I think, off his... Is he a hamstring, Jareem Buller, actually, from memory? Or is he hamstring or calf? So maybe if you need a fullback, maybe if you need some second row depth with CY Wong, if you think the Roosters can get it all together, there'd be other ones I'd have on the list there, Brian. But like your calls about the outside backs, they're good ones. Last question here is, what's the most common ACL graft that are used in NRL players, and which one do you think is best for recovery?
Yeah, I think typically it's hamstring, or if you go historically, I think that's been changing a little bit with the introduction of quad tendon and those kind of things. It's been leaking away from hamstring going to quad. My favorite's patella tendon. It's got the lowest failure rate. Typically, I know there are some studies that seem to be suggesting there's a bit of an evening out there, but yeah, it's just, I think, with the benefit with the patella tendon is it's like patella tendon bone, so you have that bone at either end of the harvested graft, so it just tends to take a little bit better, is how it's been described to me. So yeah, for me, patella tendon. But what I would say, and especially if this person is asking for their personal, like potentially they're looking at an ACL surgery, like chat to your surgeon. Like I can't believe how many people get in, and this happens to patients all the time. They get into the doctor's surgery, and especially because they're a big hotshot doctor and they everything looks professional. I don't know whether people just get like stage fright or they get intimidated and they just don't talk. Like, just you're paying this person so much money. Like, ask them questions. Be like, hey, can you talk me through graft options? Like, let's talk about that. Tell me why you do one over the other and those kind of things. Talk about it with your surgeon, because you might have, like, he might have found something with you where he's like, oh, I think hamstring's going to work better. I really like quad for this reason and that reason. Just talk to your surgeons. Like put them, I know they're the professionals, but they like, I have people coming into me a lot, and I'm sure you're the same. Like, and they almost unload the questions on me, and I'm like, man, you need, like, this is stuff, and it's like post surgery, and they're asking me these questions. I'm like, you need to talk, so they feel comfortable talking, and you don't have to go in there and like do the whole like, I've done my own research and here's what I found on YouTube. It's like, just genuinely be curious. I love when patients are curious and take an interest in their own health, like, and ask me questions. It's like my whole thing that I do day to day, but also on social media as well, is education. I'm sure you're the same on that front, mate. Just ask questions. Hey,
Yeah, most definitely. Any type of surgery, any type of specialist appointment, any general health follow-up, even any mental health follow-up, all under the same umbrella there, Brian. I think genuine curiosity, knowing your options, that is the definition of informed consent, as they say, isn't it, in the healthcare field? So I think definitely do those things. In terms of ACL stuff, like, I guess I'm a little bit out of the ACL game as it stands at the moment, but I guess there's been a bit of vibe around quad tendons, hasn't there, really, more recently? I know Shandor Earl spoke very highly about his quad tendon compared to, because he compared his to a hamstring he had in the past, maybe, or something like that. I think he did a comparison. He said, yeah, quad every day of the week was his best one. So yeah, it's an interesting space, and I think there's pros and cons to each one. And I think to your point, the failure rate's the big one though, Brian. Is it's just that you just don't want this thing to fail, because then you're in the hurt locker in a big way. So I think whatever one doesn't fail is the best way to go.
100%, mate. I agree. Mate, we have a big SuperCoach Corner this week because we're going into round 20, and round 20 is the kickoff of the Run Home Challenge with the SC Ballers, mate. I am keen. I'm floating it around, I think it's 5,000th or 4,500th overall, so I'm well and truly out of the hunt for the top prize, the 50K. But the Ballers have got $7,000 in cash prizes, including $3,000 for the winner. Payouts all the way down to 10th up for grab in the Run Home Challenge. So if your SuperCoach season has fallen apart, don't check out just yet. It's your second chance to win big, and it's live now. So head on over to baller.live and follow the link on the homepage to join the challenge. No stress, no hoops. It's as easy as that. It's literally just a SuperCoach league. You click on the link, it takes you to a SuperCoach league. And away you go. It's free to enter. There's no, you don't have to put in a credit card, nothing like that. just get into baller.live, head on over there, and you'll get in the league, and there's weekly, I think, giveaways and prizes as well for weekly top scores and those kind of things. So I love that the Ballers have done this, because I think this is the time of the year where you and I get low on trades and the interest kind of wanes a little bit. This is where draft comes into its fore, where we really froth draft and those kind of things. And I'm not a big head-to-head classic kind of guy, because I think head-to-head, everybody's team is just so similar. It pisses me off more than anything. But yeah, baller.live, BALLR.live. Your run home starts now. James, are you ready to be a baller? Hit us with your plans. What are you going to do with your very little trades to win the run home challenge?
All right, Brian, let's launch in. So this week, what did we score? 13-33. That sounds like an ad for something, doesn't it? 13-33. So I left the captaincy on Teddy, so I left some points behind there, sadly. I bought in Harry Grant and Zach Lomax this week for Sandon Smith and Jarrell Skelton. So I understand Harry Grant's a chance of resting, but when I saw Headgear Harry in Origin 3 looking hot as fuck, I was like, well, I'm going to douse myself in Queensland spirit with him instead of Connor Watson, who really, when you put it on paper, is probably the better play. But I'm like, nah, I'm going to do Harry Grant. Stuff everyone, up yours. I'm going to do my own thing there. So my pod play of Jaden Stewart's come through for the last couple of weeks, which is good. So happy with that for him on the run home. He plays every game as well for the Dragons, so hopefully he keeps rolling through. I'm also really happy with Jesse Raymond and Ronnie Militalo at sub 4% ownership. I think if the Sharks can just heat up a little bit on the run home, I think that'd be really valuable. The only other one who is really interesting to me, and I don't think I've got trades for it, but I think other people playing along could do worse than consider RTS. He gets the Titans twice before the end of season, which just means he could just put up enormous points in those two games, especially the Warriors are a really sound team. I think he could do worse than RTS, who's sort of basing and powering pretty well as well. Next week, I say I'm going to definitely do this. Actually, no, I'm probably going to do it, Brian. Let's be fair. I don't have any self-control. We never hold our trades this long anyway. Probably going to trade Dylan Lucas. I don't think I can quite get to Valentine home, so I might go for Brian To'o, who we spoke about earlier. He's got that 4-round draw that looks really good. He is about 3% owned. Angus Crichton is another one who's low ownerships. The other plays are trade Papenhuyzen or Drinky to Dylan Edwards, who's at 2.5% ownership, or Latrell Mitchell, who's 4% ownership. Who knows? Maybe all three. I've got a boost left. But if I use 3 trades this week, I would have 1 left between round 20 and round 27. So it might be a really dead shit thing to do, but it probably would be fun for about 3 weeks. So I think, Brian, if you're thinking run home challenge, my thinking is double fullback trade is really probably stupid, but it would really separate you for the run home. So I think that's the thing, is you don't want to have a very like for like team with a lot of other players, like other super coaches. You want to try and think, okay, if people own Drink and Paps in big numbers and people have low trades, they're probably not going to look at moving those guys. That could be where you make a lot of inroads in a point in difference capacity. What are you going to do this week, Brian? No, tell us about your score and what your plans are for the run home challenge between now and round 27.
Mate, I am 100%. You and I are like the same person when it comes to this kind of stuff, because I could not be more about that. Very quickly, I scored 13-13. I brought in Kiraz and Watson. I VC'd Nico on Friday night, which helped me big time. So I looped that around. Once again, we don't get it right very often, James, but we spoke about on this show how Nico, he's just got that upside. He's top 3 draft pick upside. Now he becomes like a VC or a C option, if they give him the keys, particularly over the next couple of weeks with the Sharks cake draw. So yeah, love Nico over the next few weeks. Mate, my plan is Pappy to Latrell. Even if Pappy's named, I'm doing it. Like I've only got 3 trades left, but I just think at the moment you need to separate yourself, and I think they're like I'm going to get the percentages wrong, but I reckon it'd be like 80 to 90% of teams up the top or in and around the place have the Teddy Drinky Paps combo. I just think in such a high upside position, if you want to try and win the run home challenge, which literally just takes your scores from round 20 through to 27, you need to differentiate yourself. And I completely agree with you. If I had more than 3, I'd probably do 2 trades, but I still want to bring in Cleary at some point. I'm going to hold off on Cleary till he gets the goal kicking back. I'm happy with Hines and Hughes until Cleary gets the goal kicking. Even with that soft draw, I just want to see him get the goal kicking back. So yeah, like my plan is Paps to Latrell, lock it in, just throb it up for the run home challenge. And just like Latrell, like I think there's, people love coming out and attacking Latrell, especially after Wednesday night, New South Wales losing. Mate, he was one of the only New South Welshmen, and I know it's Latrell in his typical way of like rolling over the sideline and getting kicked in the nuts and carrying on and blah, blah, blah. But like, he had so much fire, and I love that Latrell. Like that Latrell where he is just like so fired up. Like he can score you 150 or he can get sent off, and I'm okay with either of those options for my entertainment purposes, James. So I'm red hot on Latrell, I think. I do have Lucas, but I think I'm just going to hold, mate, because like it's second row doesn't really do much for me. I'm just not I'm not looking at anyone in there being like, oh, I need to bring that person in because I need to start them, because I've got like 20 guns pretty much to play week in and week out at this point in time. I went through and had a count. And that's not even including like a Karapani, who I think with the Broncos, with their draw, like on weeks, like I know he didn't do fantastic this week, but that left edge for the Bronx, like he is absolutely playable week in and week out when he's starting on the left edge for the Bronx. So, and then Kane Bradley as well, who like he's another one who probably isn't going to be around, but like if he's playing on the wing for the Storm, he's very startable too. So yeah, I'm pretty happy with where my side's at. I'm happy to just go Pappy to Latrell. I think the one that I might dice up is do I go to like a To'o potentially, but like I've got 3 trades. One of them is going to be Pappy to Latrell. The other one has to be saved at least for Cleary. So that's why I'm wondering whether I just save myself one trade, James, like just one, to get me through and kind of see where I'm at. But yeah, Pappy to Latrell is just all vibes for me at this point in time, and I'm about it. Talk me off the ledge, mate, or are you happy with my Latrell vibes?
No, I'd never talk you off the trail ever. You wouldn't see it happen in this household, that's for sure, Brian. So, no, I think it's a really good shout. I really like that idea, especially at his ownership. And at price, he's not hard either. He's only at 640. Dylan Edwards is at 640 as well. Like I just look at the Panthers' draw upcoming is pretty good. So I think when we draw the Panthers up, sorry mate, I had it up just here a second ago, but they do have a pretty good draw upcoming in the short term. So they go Bunnies, Tigers, Titans, Knights. So like we said for To'o, I think we could see Dylan Edwards go absolutely ballistic in there, especially if there's a world where Alamotti doesn't kick and Nathan Cleary's not kicking long term. It's a bit of a watch and wait there, because as we know, last year Dylan Edwards scored absolutely huge points. The base is just so good with Dylan Edwards, though, isn't it? When you look at what he's able to do week in, week out from a base statistics perspective. But even if he's not goal kicking, he's still, floor of 60. And then if he scores a try, set with one up, he's 100 easy. He probably doesn't have to do as much as Latrell does, but then Latrell doesn't have to do much, but he always does heaps. So he's that sort of enigmatic SuperCoach player where you're just like, oh mate, this guy's on about 10 points with 20 to go, and he'll just roll out an 84 with a sin bin in there in the last minute as well, just for good measure. He's that sort of guy that you get a lot out of. So I think on watchability it would be good, but I just don't know about the strength of that Bunnies team, whether they just get rock and rolled on the run home there. They're languishing in the bottom of the ladder as well. So I just wonder if they're out of contention, does Latrell get put on ice for season 2026? I don't know. It's a tricky one because they're only 6 wins and they've got the round 26 bye as well, I think. So you do miss that 1 week. It's a tricky one.
Yeah,
But I love Latrell in SuperCoach. Like he's nearly in the Tom Turbo breath, where it's like if Turbo's playing, he's in your team. But Latrell may well be the other one as well. It's a good shout.
So my other run home challenge, which is kind of on the turbo train as well, but mainly around Garrick. Like if you're trying to win the run home challenge, I'd be trading out Garrick, and that's I know that's controversial because he's on the left wing, which is like a wonderful place to be in that Manly side. But their draw sucks, man. Like they have so many strong teams on the way home. They don't have a bye. I get it, but like if you don't have any fires going, I would much rather Brien To'o over Ruben Garrick. Like I would even rather like a Jermaine Asako over Ruben Garrick. Like I know there's people talking about trading Asako out. Like I just think Yeah, I'm happy. I'm happy. Look, I've got to hold him, so like I'm going to have him week in and week out. So don't get me wrong there. But if I'm going to bet against anyone, I'm happy to bet against Tony Siebes. Just bed shitting it at the end of the year.
Yeah.
That's kind of where I'm at with it.
Yeah, totally agree with you there, mate. I think the only other one would be like, if you're carrying a Campbell and Munster, you could maybe move one of them to see if you could jag another centre wing spot in there. I think would be a better way to go rather than running heaps of halves. And I think Jerome Hughes, he's got a good draw for the next few weeks, but then it does get a little bit tricky for the Melbourne Storm towards the back end there. And I think they do get the Broncos twice on the way home, which isn't a cake matchup, but then the Storm normally give us an absolute thrashing. So maybe that is a cake matchup for the Storm. They always give us an absolute rugby league humping every time they come up the Suncorp or we go down there. But they run into Manly, Roosters, Eels, Broncos, Panthers, Bulldogs, Roosters, Broncos. It's not the best draw coming up, but then the Storm they've been scoring points willy-nilly, haven't they? They're sort of in the Finns level of attack this year. So maybe you just roll with Jerome Hughes and he's relatively matchup proof anyway, so I can hear that. But I think Cleary's got the better draw for the next 4 weeks.
Yeah, mate, it's a real tough one. But I think run home challenge wise, I would be aiming to start like at least 5, but potentially 6 CTWs every week.
Yep.
Like that's the way I'd be looking at it. Like I just think you're not going to win the run home challenge. It's so short, right? Like you're not looking for a guy who's going to average, 70, like over a 7-week period, and it's going to do you well. Like I want a guy who maybe averages like 90 because he's got like a cake matchup over the next month, which is someone like To'o, right? Like he has that benefit. So yeah, give me that every day of the week. That's the way I'm going to be approaching it, is trying to start, like I'm going to avoid like reserving a base stat forward wherever I can, I think is my general
Yeah.
approach, but we're pretty
Last one
willy-nilly
there,
with
Brian, is the Sharkies. Like, you just got to look at the Sharkies backs, I think, as well. Like, their draw, we sort of touched on it last week. Roosters, Rabbitohs, Cowboys, Dragons, Titans, Knights, Bulldogs in the last round, which they may rest for, and the Sharks may have to play. They showed the other night, they're a team, if they get it together, they can score points, and they do. Mills Hallow can go on those sort of streaks, and he'll be sub 400 grand next week. So if you're looking at getting anyone in your team, have a look at Ronaldo Militalo. I was going to joke about him having Queensland spirit as well, but that's sort of we missed a vote on that a couple of years ago in the deep depths of controversy there. But you know, from that sort of south side of Brisbane, that south side Logan area, could do worse than Ronnie Militalo on the left wing because man, when he scores points, they come in absolute buckets.
Mate, he's as Queensland as it comes, mate. Like he's been in camp.
100%.
That's all I need. You talk about, has he flown over Queensland once or did he have lunch in Queensland once, mate? Ronnie Militalo, he played under 19s. Come on now. What a rort. All right, guys, that is a wrap for this week. If you like the pod, give us a review, recommend to a friend. James, a good week. We're happy this week. Sorry to everyone who had to listen to our Origin rumblings, but not really because Queensland spirit and Daddy Billy, how good. And as always, up, that's exactly right. Up the mighty Redcliffe Dolphins.